This is Black Mental Health Matters. I'm Dr. Carrie-Ann Williams. I'm a psychiatrist practicing in Massachusetts, and this is a podcast about everything related to mental wellness in the Black community and beyond. Recently, it was announced that Bruce Willis, an actor known for such blockbusters as Die Hard, Pulp Fiction, and The Sixth Sense, was diagnosed with frontotemporal dementia. Previously, he had been diagnosed with aphasia. So, what is aphasia and what is frontotemporal dementia? And how does this relate to us in the Black community? Well, stay tuned because today I'm going to talk about all of this, though I'll only be scratching the surface because today's episode is a mini episode. To start off, you're going to hear me use the word cognitive. What is cognition? Cognition includes a few things: decision making, speaking, which I'll come back to the topic of aphasia, remembering, which memory is often associated with dementia, solving problems, moving your body and doing things, which has a technical term called praxis, and being oriented to where you are, who you are, and the situation that you're in. Dementia is a cognitive disorder. In fact, it's known as major neurocognitive disorder, and it affects very often many of the areas that I just mentioned. Now, when one of those areas is affected, it will influence the person's behavior. So they will start behaving differently. And some people, before they're diagnosed with dementia, start to experience an off-baseline level of anxiety, depression, sleep problems, psychotic symptoms, even aggression. Bruce Willis was diagnosed with frontotemporal dementia. This was historically known as Pick's disease, named after the neurologist who first described it. Dementia is progressive, so all those elements of cognition that I spoke about, they will worsen over time. Now, most people who have dementia have Alzheimer's dementia or Alzheimer's disease. You've probably heard of Alzheimer's disease. The second most type of dementia is caused by cardiovascular disease, so heart disease, high blood pressure, cholesterol that's high, stroke. That's called vascular dementia. So this frontotemporal dementia or Pick's disease is not as common as the other types. Frontotemporal dementia is named after the area of the brain that is affected. So fronto for front and temporal for where the temples are located, frontotemporal. Okay. But first, last year, Bruce Willis was diagnosed with aphasia. And I remember when I first heard that announcement, I thought, that's a bit surprising because I always tend to think of aphasia as a symptom rather than as a standalone diagnosis, which means it doesn't just happen on its own. It's caused by something. So I remember thinking at the time, there's got to be more to this story. What's causing the aphasia, right? So let me explain what aphasia is. In the brain, there is an arc that language travels along, like a highway from one point to another point. The first point is called Wernicke's area, and the second is called Broca's area, again named after people. The highway is called the arcuate fasciculus. Now, these two areas with this little highway is responsible for understanding and processing language and converting it into speech. And speech has a couple of parts to it. There's a part of speech that helps us to kind of just speak logically in ways that we can understand. But then there is the ability to speak fluently. That is to not hesitate, to not have difficulty getting your words out, for the words to just flow. Now, I want you to take one guess as to where this language area that causes aphasia is located. Well, Wernicke's area, which is where you receive language, is in the temporal lobe, so near the temples. And Broca's area, which is where you express and kind of have the motor control of language, is in the frontal lobe, so frontotemporal area, okay? So when they announced aphasia as a standalone condition, it was mostly meant probably that they were still doing a medical workup to confirm the cause, because strokes can cause aphasia, other things can cause aphasia. In this case, it happened to be a progressive dementia in the same area of the brain, frontotemporal dementia. I'm going to say a little bit more about aphasia. There are two types of aphasia that you should know about, and it depends on the language area that is affected. Now, remember I said Broca's area is where you express speech. It's where you kind of control that motor aspect of speech. So if that area is affected, then you'll have what's called a non-fluent aphasia. Your words aren't flowing. It's an expressive aphasia because it affects your speech expression. But if that motor area is not affected, then your speech is going to be fluent. The words are going to flow. However, if the other area is affected, the Wernicke's area where you receive language, then you're still going to have certain other problems because that area is where you receive language. You'll have a receptive aphasia. That's going to affect your ability to receive. So expressive versus receptive aphasia. And sometimes they test this kind of language function by asking people to repeat something that's said, because that repeating of something that's said involves both receiving language and expressing it. So what about that little highway in between the two areas, that arcuate fasciculus? Can that be affected? Yes. So what happens if you damage that connection? Well, in that case, the speech expression is intact, so your words are flowing, and the receiving of language is intact, but the communication between the two areas is affected. So if somebody asks you to repeat something back, you understand what they're saying, but you can't relay that message from the Wernicke's area to Broca's area, so you can't repeat it back. Okay? You can't follow the command, essentially, to express speech. Now, the last thing I'm going to say about aphasia is global aphasia. And this is where the damage to that area is just so extensive that a person has more severe problems communicating and may become mute. They may still retain some ability to understand language, and they may respond by gesturing, or they may be able to follow commands. Now, in frontotemporal dementia, the person would be more likely to have that non-fluent or expressive type of aphasia. So then it would be noticeable, especially for a celebrity actor like Bruce Willis. It would be very noticeable. So it makes sense that that was kind of something that was announced earlier, that his family and his publicist would formally let everybody know, hey, if you notice that he's having problems with his speech expression, he has a diagnosed condition. It's called aphasia. So people have a kind of a way of describing what they're observing. But then he's now been diagnosed with frontotemporal dementia. So how is that different from Alzheimer's dementia? Well, frontotemporal dementia can start a little bit younger, like mid-50s, whereas Alzheimer's tends to start kind of closer to retirement age, like 65 plus. Now, Bruce Willis is 67 years old, so he's receiving this diagnosis in his 60s. But frontotemporal dementia is an illness that just in general, in terms of statistics, can start earlier for some people. People with frontotemporal dementia may not have the kind of noticeable memory problems that people with Alzheimer's dementia have. In Alzheimer's dementia, memory problems is one of the most noticeable things that people know about it. It's one of the most noticeable things. And so it's one of the contrasts of the two, kind of the way that both kinds of dementia evolve. Another contrast is that people with Alzheimer's disease may not have any significant behavior problems at the beginning. They tend to have behavior problems sometimes in the mid to late stages of the illness. However, people with frontotemporal dementia tend to have some behavior problems earlier on. And so sometimes it's the first thing that's noticeable. They may have certain kinds of compulsive behaviors, and there's something called executive functioning that's affected. Executive functioning is like decision-making and staying organized and controlling your impulses and staying focused. That can be affected. Then, as I spoke about with the aphasia part of things, people with frontotemporal dementia tend to have problems with speech expression, like Bruce Willis, whereas individuals with Alzheimer's dementia don't typically have trouble with speech until the late stages of the disease. So a few differences between the two things, and maybe explains why maybe people might not have noticed that this was going on, and why the diagnosis may have been a bit delayed. But that's your neurology class for today. But this is a podcast about Black mental health. So why is it important for us in the Black community to talk about dementia? Well, here's the thing, guys. Older Black Americans are actually twice as likely to have Alzheimer's dementia and other kinds of dementias compared to white Americans. So we actually have a higher risk. But in our world of health disparities, the diagnosis is usually delayed. Sometimes there's issues with access to care. Sometimes there's disparities with healthcare coverage and other structural issues. Of note, the research has shown that Black Americans were more likely to have behavioral changes or psychiatric symptoms as early signs of dementia. So it doesn't come as a surprise to me that when a Black person presents to the healthcare system with behavioral symptoms or psychiatric symptoms, that there is a disparity in how it's interpreted. The other thing is that there are certain health conditions that disproportionately affect Black people, and those health conditions are risk factors for developing dementia, like heart disease, high blood pressure, high cholesterol, stroke. Those are risk factors for vascular dementia, right? There was some research that was published last year that looked at brain MRIs and found that Black participants showed certain brain markers of aging in their mid-50s, which was early compared with the white participants. So this finding of these earlier kind of markers of aging at relatively younger ages is thought to be associated with a concept called weathering. And this is where chronic racial stressors and structural disparities increase the risk of medical and psychiatric conditions. And these are what we call modifiable risk factors. So that means that there are ways that this can be improved. We can do better. But that's all I have for today in this mini episode. So let me know if you want to hear more about dementia, how to recognize it, how to reduce your risk. Thanks for joining me today for Black Mental Health Matters. I'm Dr. Carrie Ann Williams. Hope you found this episode helpful. Have a great week. Take care.